All right. February 19th. Oh my goodness, February's almost over. We got only about, what, 9 or 10 days left because 28 days in February. Hope everybody's doing great. It is a wonderful chilly day here in Green Bay, Wisconsin. It was still below zero this morning when we got up. But now it's beautiful. It's supposed to start warming up. It's supposed to be in the single digits tomorrow, which is great. So we're going to do our question and answer, and it's kind of fun because I always like to start out with a business question. I did not realize me talking about business was going to be so, impactful. And granted, obviously, I've been a businessman for 26 years, but on top of it, my main form of business was healthcare. Then obviously moved into other things besides just 90% of my focus is still all healthcare stuff. But it's really funny. So I have to tell you about a story. I was having a little conversation with my nephews. Three of my nephews, Brandon, AJ, and Sam, were all in the car, and my nephew AJ said to me, Uncle Patrick, seems like everything you do, you're good at. And I'm like, and I was kind of laughing a little bit. And I said, well, AJ, let me explain this. Now, AJ is a scholarship basketball player down in Florida. He's in a sophomore year. He was extremely talented. I said, AJ, if you actually saw me shoot the basketball, you would probably laugh and giggle and stuff because, I would be throwing up bricks all the time. And I'm not a basketball player. But then when people see me golf or do I do business, it just seems like when I do things, I do them really well. Well, it's because I only have so many things in my life that I do. I don't spend time on everything. I think the jack of all trades is actually a very, misleading thing. I want to see somebody be really a master at something. So the only thing that I really focus on for sports is actually golf. And of course, that's why I'm really good at it and stuff. And so and this relates to the business question, it's like people don't realize is how to become good at golf. Trained on it, learn from experts, learn from people. One of my favorite golf coaches right here, Sean Clement. I literally train on a video every single day. And then I go and work on it. I have a mat here at the headquarters back in the gym, and I swing on it. So it doesn't matter what your trait is. It could be a chiropractor, could be, real estate, could be healthcare, could be software, could be anything. You just train. You learn from people that have done it and done it well or done it like you want to do it. And if you're an innovator, you might have to create something and just continue to train to make yourself be persevere in things. So I can honestly tell you, I just only focus on a couple things. I do them extremely well, and then what I do is I actually keep that the center focus of my life on as far as business or even personal things. So it allows me to look like I'm skilled at the things that I do. So that's the great part. I will never want to be known as a jack of all trades. It's like this. I've always said this to even doctors. Who gets paid more, a general practitioner or a specialist? A person that's a specialist is a master of his craft, and I want to be a master of anything that I do. So, that being said, we're going to take our question and answer. And please do me a favor. Don't ask me about migraines anymore. Don't ask me about it. We get a question about migraines. Go back and watch the other ones that way. Yeah. So anyways, I'm just like, get the same question every single day. I have migraines. What do I do? And stuff. It's like, if you're just watching this, go back to my other videos and stuff. I have a ton of videos on it that way. So, all right. What do we got, Trini?
Is infrared sauna okay while breastfeeding?
Is infrared sauna okay while breastfeeding? Yeah, obviously, when you sit infrared sauna, there's certain physiological things that do happen, and there can be some consequences to it that way. But I would say generally it's going to be safe. Obviously, if you are, highly toxic and starting to recirculate things, that could maybe disrupt the breast milk a little bit that way. But go in the infrared sauna, pump and dump, and then you should be just fine.
How do you get rid of TPO antibodies?
Okay. It's difficult. You need to find the things that are excessively triggering the immune response. That could be infections, that could be foods, that could be stress. And then you want to do things to make sure that your thyroid is actually doing well. So like selenium, ashwagandha, iodine if needed, if you're deficient in iodine. But what it comes down to is really, calming the immune effect down. And so therefore, no matter what autoimmune condition you do have, because if you have TPO antibody, it's based on Hashimoto's, then you want to be able to actually start taking high levels of vitamin D. High levels of vitamin D are extremely crucial to have that be reduced. Always got an extra. Oh, just as you guys know, we got Hunter, Trinity, Christy in the room.
My daughter's allergic to strawberries. She was put on Zefalexin,
Yep.
and it has strawberry flavoring in it. Is that still okay to use?
Yeah, if you're allergic to strawberries, I'd stay away from any flavoring too, just because there could be a reaction to it. So I would definitely stay away from it.
How do you feel about the natural GLP-1?
How do I feel about a natural GLP-1? I don't know what they are. I mean, there's foods that by nature release those peptides, but there's not going to be a supplement that they're going to do and stuff like that. And here's what happens. Coming back to GLP-1s and they're trying to lose weight, it's a very difficult process to lose weight, okay? Because it takes a lot of emotional stability. So I don't care if it's natural or Ozempic, if you're trying to compensate for your bad habits that are leading to your weight gain, it's just coming back. It's just coming back. There has to be more of a mental shift than a natural shift, or even a chemical shift.
What are your thoughts on hydrogen water?
My friend Dan, who's a pharmacist, sent me one research article that was very credible, and I liked it, read it top to bottom a couple times, and it seemed like there was some health benefit to it. That's the only thing I know about hydrogen water. So I do have people that actually take it and tell me they do notice some positive change. So I actually, my only response to it right now is there's a positive benefit to it because of the one research article I did read, and I'm not saying there isn't more articles out or there should be more research done on it, but I do see some positive benefit from it, and for the people that do it, they tell me there is a positive benefit.
Why won't armpit lymph nodes completely go away post-pregnancy and breastfeeding? Is there a way to drain them?
I'd be more concerned that there's an infection or some immune triggers that are still there, and I wouldn't want them to go down because I want them to deal with the infection. So you got to get rid of the infection or an allergy that you have either developed during pregnancy or post-pregnancy.
My mom has neuropathy in her feet. She thinks it's from radiation for breast cancer. Can she reverse it, and how?
As long as there's no permanent damage, but yes. Well, every time that you do radiation, you should be doing high levels of vitamin C because vitamin C is more protective when you have radiation exposure. But then there's a lot of neuropathy that happens due to the fact that there's damaged nerves. So I want her to get a fat soluble B1, make sure she's reducing her sugar like crazy, add cod liver oil, and therefore you're gonna, by taking high levels of a fat soluble B1, it's going to really help with the neuropathy, but also she's going to make sure that she actually watches her own blood sugar levels because that can be a contributing factor also.
What can help with dry eyes?
Most of the time it's a vitamin A deficiency that's there, also a little bit of a vitamin D deficiency. So start by, increasing your vitamin A. Take some cod liver oil. And also there are some drops you can put in your eyes.
How to detox the liver?
How to detox the liver? Well, first of all, stop putting bad stuff in your body. Too much sugar, processed food, things like that. And then what you do is you can support specific pathways, phase 1, intermediate, or phase 2. I always encourage people to do milk thistle or turmeric together. Sisandra is something that I think that most women should be taking on a regular basis to support all the aspects of liver. But those are really good ways. But I tell people I'd be more concerned about high carbohydrate consumption for a long period of time and also putting highly processed food in there to actually having the burden do it.
Can reishi supplement be taken while breastfeeding?
Yes, absolutely. I think that the medicinal mushrooms are essential when women are pregnant. I think it's part of I put almost every woman that I took care of that was pregnant on all forms of medicinal mushrooms. Of course, because of the immune factors that benefit them and also benefit the child.
Recommendations for pinworms, and how long does it take to get rid of them?
Recommendation is everybody should be on a yearly basis doing some black walnut and some wormwood. Wormwood you have to cycle on and off of. Black walnut you can stay a little bit longer on there. And no one's going to know because you're going to have to build your immune response back up. And obviously if you're immune deficient, it might take months, and obviously some people could take some black walnut and some wormwood and actually have them move out very quickly.
Best non-toxic way to whiten teeth.
Hydrogen peroxide and baking soda combined is probably one of the best ways for your teeth. Now make sure it's a food grade hydrogen peroxide and baking soda, and it will do a wonderful job of changing your teeth color.
What nutrients are good for protecting eyesight as we age?
Vitamin A and vitamin D. That's why I love cod liver oil. The one thing I'm very proud of is I have great eyes. It's still surprising my wife. We'll be driving at night and a long distance away. I'll read a sign and she's like, I can't even see the sign yet, and stuff. She's laughing right now because it happens all the time. Like, my eyes have always been great, and I think it's because I'm obsessed with cod liver oil, and I think it's one of the greatest things that people can take and stuff. So there's massive benefit to it. The vitamin A and vitamin D. Forget all the rest of the omega-3s in there, but just the vitamin A and vitamin D alone, I think it's a great thing you need on a regular basis.
What are some natural remedies for lymphatic system health?
Number one, movement is number one. Lymph nodes actually are contracted and moved when there's muscle contraction. So I want to see people move as much as possible. Vibe plates are absolutely incredible. Also, it's going to sound funny, inversion. An inversion table does a wonderful job. But that's why movement is so good for our immune system, because our lymph nodes contract when our muscles contract, because there's actually a squeezing effect to it that way. So therefore, I like to see people move a lot more. I like to see people do vibe plates. I think they're essential for good immune health.
My sister, 26 years old, got an infection from her femur surgery. What supplements should she take to help fight the infection and build up her gut from the antibiotics?
Well, number one is this. If you are on any form of antibiotic, I'd encourage you to take some massive probiotic over the course of time, but also add lots of fermented foods. Fermented foods are very key to everything. Fermented foods are key to so many great things out there.
What do you think about methylene blue powder?
I think it has some major benefits. I think that obviously you need to do it under supervision and stuff, but I think that there's a major benefit to it. I know Nicole has given it to many people, and I trust Nicole's clinical things about it, and I've read about it that way, but it's something that I don't do. But I think it has actually massive health benefits, and if it's done right by an integrative doctor, I think that you'd get a wonderful benefit from it.
What are your thoughts on gummy vitamins and supplements? Are they as effective as liquid or pill form?
No, nothing's more effective than liquids, period. There's nothing. I will debate anybody or have any, easily show the massive difference of it. Even the bioavailability, even joining stuff, even doing everything, they're just better. Gummies, I think, have major benefits, except for I'm very concerned about the amount of sugar that they put on gummies. That's one thing I'm very cautious about. So, yep.
Are there things that people can take naturally to fix the thyroid to the point where they'll be able to get off of the supplement
Are there things? Absolutely, there are things that you can do and stuff. Now, the things you can do are first of all, you gotta get your labs done, see where everything's at, and then you need to make sure that you have the ability to work back on things, because there could be an iodine deficiency, there could be selenium deficiency, it could be vitamin D deficiency, there could be autoimmune process, there could be so many things involved in that. So yeah, there's a significant amount of things you can do. I've really helped thousands of women get off levothyroxine and Synthroid. Now let me explain though. Let me make it very clear on this. I personally have never taken anybody off the medication. In 26 years, I've never removed any person from their medication. Let me say it again. In 26 years, I've never removed anybody from the medication. They always worked with their doctor. And as we start to give you an example, if a person was on levothyroxine and all of a sudden we started to help them, we'd start to get their own hormone production to come up, and then it would move them into a hyper state. And I said, listen, one of the first things that you'll notice is your heart will start to palpitate and race. And then all of a sudden I'd get a message from Rosanna would come to me and say, doc, person called and they have a heart race. I'm like, well, go to the doctor immediately, or even go to the emergency room and get your levels measured so you don't get a hyper situation that way. And they do, oh my goodness, your T3 levels are elevated, T4 levels that way. And then they'd be like, oh, we gotta do something. Like, yeah, drop back on your levothyroxine, drop back on your Synthroid. And the doctors then wean them off. Okay, so if you understand what it did, very simply was, and then the physicians sometimes would call me and say, what'd you do? Well, I'm just started to support their thyroid function, found out why the immune process was there for autoimmune, found out why they were deficient, why they had these issues that way, and their thyroid started to function normally. and stuff like that, and therefore, you're going to have to make the choice to wean them off or not. And I said, if you don't wean them off, I tell doctors, you're just going to have to deal with a hyperthyroid-based person that way. And of course, then the patients would be like, Doc, my levels are elevated. Why wouldn't you want to? And there's some doctors that tried to fight them, said, you can never go off your medication. They went hyper, and they actually end up almost in a lawsuit trying to actually sue the doctors because their levels were getting, and they're still keeping, no, we got to keep you on that medication. It's like, you're putting me in a hyper state. So it's quite crazy. So I had some pretty good stories and battles with that stuff. I know we're doing a very short live because I have a 12:15 meeting, so we got about 1 or 2 more questions. What do you got?
What can I take instead of cod liver oil as I'm allergic to cod?
Just some good omega-3s. You understand? Some good omega-3s, and make sure that you eat some organ meats to get you good vitamin A. I'm a big fan of organ meats. Liver, heart, kidney, some of the best ones.
I noticed that my eyes, oh, shoot, it moved. Sorry. I noticed that my eyes are less sensitive to light since I started and did the no sugar challenge.
Good.
Is this a coincidence or could there be a connection?
No, remember, one of the biggest things that do happen, we talk about neuropathy, nerve damage, oxidative stress, things that do happen. When you reduce your sugar levels, you do have less oxidative stress. Remember, your neurology is very affected by high levels of sugar for a long period of time. So therefore, reducing your sugars, you're going to actually have, remember, the optic nerve, you're going to have better responses. That's why if you notice, diabetics have a very hard time with their eyes. It's very common for them to do it that way. So it's not a surprise.
My friend has high estrogen nipple discharge. What can she take?
That's very difficult because I don't know what estrogen is. And second of all, she has to make sure that there is proper liver function through phase 1, phase 2, but also making sure that she has some like calcium D-glutarate to bind so it can actually move out through the system through her GI. So she needs to see labs, and she needs to get a little help clinically.
Is there a vitamin or supplement that you recommend for overall health of a toddler?
Yes. Glandular. Liver glandular. I'd rather have them eat some liver every single day, just like my girls did, but liver glandular. Here, watch this. Liver glandular, cod liver oil. Right there. Right there for a child. Liver glandular, cod liver oil. Liver glandular, cod liver oil. Now, once again, I'd rather have them eat liverwurst and eat cod liver, but guess what happens? Most of them don't. So they got to take it in pill form. But I will tell you right now, liverwurst, or cod liver, or just a liver glandular, and then cod liver oil. Sorry, I'm burping up my Zevia, my lunch. I got time for one more question. I got to show you. I don't know if Jordan and Dr. Jordan or Dr. Laura listen to me, but you can see I got my meeting with Dr. Jordan and Dr. Laura. They can probably wave, show that way on camera and stuff. So it's kind of, yes. So, but yes, got time for one more question.
Natural alternatives to HRT for menopause or perimenopause?
Great question. When you look at the things that do happen, the deficiencies that women go through when it comes to hormones, estrogens, progesterone, DHEA, their androgens. Remember, when women are cyclic, there is a ovarian stimulation of a follicle that causes a lot of release of hormone. It develops through the month. There's release of all the hormones, including progesterone. And then when they move into menopause, there is actually production by specific organs, mainly adrenals, and a lot of conversions. So if you are actually in menopause, you're going to have to support the organ. Now we have adrenals, but also the conversions, which happen mainly in liver and also in adipose tissue. And then if you're, so therefore, licorice, white peony, milk thistle, black cohosh, absolutely amazing for menopausal women. On the flip side, if you're cyclic, you would have to divide out your cycle a little bit and maybe take some Don Quai the first couple of days that you menstruate. Second part, chaste tree, ashwagandha, things to really, it's very detailed and very specific, and it's also based on levels that you might be deficient in. So therefore, get some labs done, and guess what happens? You'll be guided properly. All right, on that note, I'm going to go to my meeting with these wonderful people. Look at all these wonderful people on I have meetings with my doctors all over the world and stuff like that, so I'm showing them on there. So, all right, so we will see you guys at my tomorrow's live.